just a general kind of how will I know? Like, how will I know how their day went? How will I know how they're progressing? How will I know that they're eating well at school or they're making friends? So I think a lot of these do have to do with students with communication challenges, especially children who are nonverbal, but it can very easily apply to all students. You know, kindergartners are very young. They have a hard time thinking about their whole day and expressing it to their parents. So I think that the most important thing that a transition team can do is to really think about the style of communication you're going to have with the parents. Think about ways that we're going to be able to communicate all of those little parts that are important to parents. You know, they want to know, did my child refuse to eat breakfast and lunch and he's coming home very hungry? Um, did my child make a friend today? Those kinds of things are very important to parents. So I think that that's a really important part of a transition team to consider when they're coming up with plans for incoming students. Um, so as an advocate, one of the things that I do to help support the transition is I try to help the families find ways to connect very directly with members of the team, like the important members of the team. So if your child is getting therapies, the parents feel more comfortable when they really have a direct line of communication, like with a speech therapist, with a physical therapist. And even in a general education setting, still it's important for parents to know who to contact about concerns that they have. So that is something that I really support as an advocate, is that I make direct contact with all of the team members and kind of triangulate uh, the communication system and really personalize it sometimes, because sometimes parents have specific questions. And if what we're sending them home for communication is not useful for them, they're really not feeling as though they have a really good picture of what's going on with their student at school. So that would be something I would also consider, is maybe asking parents what kind of information they would like to have so that we know we're giving them what it is that they want to know. And while there is quite a burden sometimes on staff to have time, parents really want a personal experience. So taking the time to know what it is that one student's parent wants to know and another student's parent wants to know, I think really that's really going to help you have a robust communication system with your families, which I think really that's what really helps your kindergartner to feel comfortable and grow, is when all of the adults in their life really are working off the same information. I would say the best examples I've had of really positive transitions. The first one would be, I had a family that was really concerned about their child's placement, that they were concerned that the kindergarten classroom that they were assigned to wasn't going to be able to meet all of their needs. And the parent was really just struggling to figure out exactly what to do. So, my role there was to help them understand who it is you contact. You contact your CSE chairperson and contact them and start a dialogue, start some communication so that they know who your child is, they understand what your concerns are. And in that time, the parent actually went in and visited with the chairperson, which can be really important because sometimes decisions are made based on paper and not based on experiences with the children. So at that time, the parents brought in their child, expressed their concerns, and the CSE chairperson wholeheartedly agreed that the placement was not going to be appropriate, and the child went to a far more appropriate placement. And that was a real win for the family, and started the child off. He ended up being in the placement that he continues to be in today. And if that hadn't been for the parent learning who it is you contact with a concern, that child maybe would have had a couple of years where they really weren't very successful, and it wouldn't have been a really good transition from preschool into the kindergarten setting. And that family I worked with later, in the child's development, and the parent was very concerned because they weren't feeling as though they were getting the kind of information from school that they wanted. So we sat down together, came up with the right kind of communication tool, and shared it with the teacher. And the teacher had no problem filling out that information because the teacher hadn't known that the mom wanted to know those kinds of things. They're little children, but all of those little children have the potential to have had a lot of trauma or to have had no trauma. And that can be um, across any kind of setting. It can be in an urban setting, that can be in a suburban setting, that can be in a rural setting, that can be in an affluent school district or a school district of lesser means. And that those are some really important considerations when we are receiving students, is to recognize one child may have had started out in an infant Head Start program and it had school programming for 3 years before walking into kindergarten, or this child might be fresh into kindergarten and this might be the only structure they have ever seen when they walk in the door. So it's good to get that information ahead of time, get that information to teachers so that they're able to support the kids as needed. And another really important part that I have found as a family advocate is that it's important not to make assumptions about parents. It's important not to assume that everyone has a high reading level. I've worked with actually 3 parents who were illiterate who didn't share that with me, who I found that out through working with them. And how that translates to the school is that the parent is not communicating. The parent is not doing the things that they're asked to do, but it's because mom can't read and mom doesn't want to say she can't read because, that is something that people really hold pretty privately. People can have a lot of shame about the things that they don't understand. So that's really important too. I always try to say err on the side of that there must be some other reason, because parents want the best for their kids. They don't want bad outcomes for their children. So usually when I have found things to seem dire, it's usually because there's a lack of skill set on the parent side. And again, they're doing the best that they can with what they have. So we need to reach out and give them some more tools that they can use.
It is important to address transition as a team because without a team, the process is one-dimensional. When educators and early childhood providers view the transition to kindergarten as a one-time event that happens in September, they fail to see the bigger picture and understand the importance of transition planning. A transition team should include members not only from the school community, but the community at large, who can bring to the table varied early childhood expertise and experiences. With a diverse membership, the team can provide a wide lens in which to view the transition process. When the transition process is developed without a comprehensive team, a disjointed experience for families is created. They are then left feeling confused and unsure of the transition process. It must be remembered that the transition to kindergarten is one of the most significant transitions that a young child experiences. What happens during this transition often lays the foundation for a child's adjustment to and future success in school. The transition to kindergarten is much more than a one-time event. It is a journey that takes time, preparation, and advanced planning. Therefore, attitudes and actions of those who are directly involved can do a great deal to make the transition to kindergarten a positive or not so positive experience for a young child and their family. Thoughtful planning for this transition can have meaningful results for the children, families, teachers, schools, and communities that last well beyond the first weeks of school. Remember that the transition to kindergarten is an ongoing process that has many steps and can be made more successful when the adults in children's lives recognize its importance and plan for it thoughtfully and carefully. With effective and collaborative teaming, a successful community-wide transition plan can be established that includes creating and promoting connections and relationships in the community, maintain ongoing communication between early education and care staff and kindergarten staff, prepare children for the transition, and involve families in that transition. Teams can encourage and support families by remembering that the transition to kindergarten is an exciting time for families, but it can also be filled with anxiety. Families have a sense of pride that their child is entering school and will be facing new challenges. There is also concerns about how their child will cope with the change, if he or she will be successful, and what changes may occur to their role as parents. They hope that the transition to kindergarten will be a smooth and happy one. Therefore, it is essential that there is frequent and effective communication with all families whose children will be entering kindergarten. This engagement must include families who have a child with special needs and those families whose first language is not English. The transition process must make families feel welcomed and involved. The transition team should include a cross-section of transitioning kindergartners' families who can be active, contributing members of the team process. Providing families with only the procedural steps to transition is important, but is not enough. The school's transition plan must include numerous engagement opportunities to build a family's sense of school community prior to the first day of kindergarten. Remember, families are their child's first teacher, and as such, educational organizations and community early childhood programs must work collaboratively to assist families in understanding what kindergarten ready really means for their child and why they have a key role in their child's development. Ultimately, a well-planned transition process benefits children, families, teachers, and builds trust and relationships for the whole school community. After your participation in today's summit, you will be provided with access to a resource titled It Takes You, Planting Seeds for Learning and Growing. This booklet was developed in January 2019 by a team of early childhood teachers and service providers and was published and provided at no cost by the Wayne County Partnership for Strengthening Families and the Wayne County Community Schools Project. The booklet is full of developmentally appropriate ideas for families to engage their child ages 1 to 4. It is organized into 6 sections: cognitive, social emotional, gross and fine motor skills, communication, adaptive self-help, and self-regulation. Additionally, the booklet has resources for families with regards to internet apps, read aloud books, and developmental checklist. We encourage you to provide this booklet to all the families you engage with. Families are essential to promoting positive learning, growing, and nurturing experiences with their child.
I feel that the school nurse helps to bridge the gap between home and school for a parent. Parents, when they hand their child over to school, they're handing over their most precious gift. I feel that school nurses are here to help. We're here to listen to them and help ease the transition. Sometimes that's things such as helping them apply for health insurance and making sure they have a doctor and they have a dentist. Eye care. Does their child have needs that maybe they could benefit from seeing a counselor? Those are the types of things that a school nurse can help with, transitioning from a child being at home to a public school setting. The screening process, the school nurse is part of a team. Generally speaking, when a child comes into school for screening, they're seen by the school nurse, a speech teacher, a school psychologist, teacher, and they kind of look at the child as a whole. So the school nurse helps to, make sure that the child's immunizations are up to date, that they've had a required physical, that we go through a screening as far as a vision and hearing screening to see whether or not maybe the child needs some glasses or has a hearing issue. The other thing that's really important during the screening is we look to see what the child's medical needs may be. Perhaps the child has asthma or a food allergy. So the school nurse would take that information and realize with the family during conversation what it is that the child needs for their safety at school. If they have asthma, do they need an inhaler? Do we need a doctor's order for the inhaler? We need the medication. And then the next step would be to, communicate that child's needs with the teachers or the people that child will come in contact during the school day. So, we always maintain confidentiality. We talk to the parent about the need to know, and in order to provide for safety for their child, that we need to share this information with their classroom teacher. So that's part of the role of what the school nurse does during screening. kindergarten transition team could help relay to families the idea that a school nurse is here to help. We're all part of a team. It's not them against us. Many times when a parent brings their child to school for the first time, they may be bringing with them some past ideas of their experiencing during school. And we want to make sure that they understand that we're part of a team, that together we both want the best for their child. We want them to be safe, we want them to be healthy, and we want them to be educated. So the school nurse is an advocate. They're here to help achieve those goals for the family and for that child. Part of my philosophy I once read was that a healthy child learns better, and the school nurses are here to help make that happen.
Libraries play a critical role in helping kids and families get ready for the transition into kindergarten. Great ways that libraries already support families in preparing for kindergarten is through story times. That's like our key thing when it comes to helping the families. It lays a foundation for socialization, developing a routine, early literacy, learning our shapes, our numbers, our colors. Learning fine motor skills, learning how to use scissors, pencils, crayons. Also, we do a sensory playtime and baby story time. So that's also working almost at the very, very beginning. Sensory playtime is very important to babies in learning all the different kinds of sensory feels. And baby story time, again, lays that early literacy foundation, helping new moms, new dads, new caregivers learn what their kid actually needs to start at the very beginning. Reading, they say from the 0 to 2 is the most important time for kids to be learning to read. So listening to their mom, dad, parent, caregiver, listening to them read stories is very, very crucial from that 0 to 2 age. We also create helpful resources, materials that families can take home with them. List of websites that are really good for education, like ABC Mouse, PBS Kids, Sesame Street. We also do take home resource bags. I have one right here. So we've developed something like this, which is for construction, and it's got all kinds of fun things inside. You can see crafts, things that help with that getting ready for kindergarten. Let's see, what else? We also offer 1,000 books before kindergarten, which is a program that we encourage families to start at birth. And if you read a book a day, by the time the child is 3, they will have read 1,095 books. So 1,000 books may sound like a lot, but it is doable. And if you read 3 books a day to your kid, you'd actually be done in 1 year. So that is something we offer. A lot of libraries offer the 1,000 books before kindergarten program. We also offer like milestones for that program, which kind of helps encourage, keep them going. So every time they reach a milestone, like 100 books, they get a prize, 200 books, and so forth. And then they also have a tally sheet. A lot of the families like to keep the stickers and those sheets as like, just something to look back on, put in their scrapbooks, and then they get a certificate at the end that shows their accomplishments. We also have interactive learning areas. Our library offers a playroom for kids to come and play those basic socialization skills, when other kids come into the room and play with them, learning to share. And a lot of kindergarten rooms have those play areas. So it's really good to, establish that foundation. Toys, manipulatives, things that help with the motor skills, anything that helps kind of broaden the imagination too, let them play and have fun. So libraries can support kindergarten transition teams with added resources, such as we offer resource totes. I regularly take to our daycare centers and the schools what we call resource totes, and basically they pick a topic that they're interested in, and we pull a bunch of books, throw them in a bag for them, and deliver it to them. which is a way to kind of support them. We also can support, I go into the, well, before everything kind of shut down, I was going to the daycares, the Head Starts, Candy Apples in Newark, and going into the schools and reading to the kids. So kind of that face value, and when they transition from the story times to the kindergarten, all of that kind of plays into that support of seeing the library, seeing the face, and continuing with, you know, supporting literature. And the daycares, the Head Starts, those are the very beginnings before they transition into kindergarten. So to be in the classrooms, talking with the kids and reading to them, supporting the literature, is wonderful. And that's definitely a great way that libraries and can support those transition teams. I would really love for them to remember libraries stand as a building block of beginning of early literacy and education for all families, no matter their background or their socioeconomic status. Schools and libraries really support and encourage lots of similarities in wanting to support that lifelong love of learning, reading, growing, and developing into future community members. So, you know, just a way to support that community is to support it from the very beginning. And schools and libraries always have been in the same areas wanting to do that. Also, that libraries are fun and amazing places to visit. Libraries are always changing and adapting to their environments. Again, we have a playroom that's just for the kids. It's amazing. It's got, you know, a kitchen set. It's got all these different manipulatives on the wall, something that, you know, you didn't see 20 years ago. It was just books. So you're seeing a lot more of that understanding of the early literacy and the fine motor skills and developing all of those things early on. Also, we're always finding new ways to support the community and its needs. To help it grow and prosper is always been our core values. When we see kids, like when I see my kids come to story time, to me, I see that I'm creating those future readers, those leaders and information seekers, and who knows, maybe future librarians too. So story times, you know, that for me is definitely the beginnings of, you know, I know my kids from the beginning and watch them grow and go into kindergarten, and eventually I'll see them as adults with their own kids, bringing their kids to story time. So that's, you know, what I definitely want those families to remember about libraries is, you know, we're there for them at the very beginning, all the way through too.
We think as a school a lot about the equity piece. So what do students need, and knowing that that's going to be very individual based on the students that we have in front of us. So we try and be really proactive of planning for the students we do know in terms of what supports they might need. We have the luxury that a lot of our incoming kindergartners have been part of our UPK program. So we have a great feel for what those kids might need academically and in terms of their social emotional needs. And we try and plan ahead to support kids with what they're going to need in the classroom. I also think we have a fabulous team when it comes to looking at student data and being really thoughtful about student placement. We try and place students in classrooms that are going to meet their needs in terms of the adult teaching style and also in terms of the peer groups that we put together. And in terms of the supports that we provide within certain classrooms, whether that's a special education teacher, an aide, a TA, really trying to set kids up for success from the very beginning of school. I don't know if there's one great success story that I have for you. I would say, you know, it sounds corny, but we would hope that all of our students are success stories. Again, for us, I think that really comes back to we've been intentional about building our team. at the early learning level, and we have fabulous people who are very invested in young children. On top of that, we've spent a lot of time building our systems, data systems, multi-tiered systems of support, and really looking for, I guess, being intentional about what we're providing for kids and being really thoughtful from the very beginning about what students need and being very, I guess, intentional about when we check in to see how students are doing, what adjustments we need to make. Again, I think we have an amazing team that puts kids at the center of everything we do, and that pays off for us in the long run. And we really have, I think, great early learning and kindergarten outcomes here because of it. In terms of the community, I think there's nothing like the power of a positive adult for kids. And, you know, community members that are positive with children, that model pro-social skills, those are all things that are important. Also thinking about the broader community as a whole, like what opportunities do we provide for our young students and for their families? So are there active programs at the public library? Are there things within the recreation department? Are there places where kids can get out and play and enjoy each other? I think too, the connection of families to school and having that be positive is very important, so that families in the community feel positively about the school. As we bring new families in, those families can connect through things like maybe PTO events or classroom activities, and that you have this great, almost ongoing dialogue between the school and the community, and this sense of connection that families know someone at school that they can reach out to. It might not be, you might not know exactly the correct person that you need to get in touch with, but you have a connection at school that can help you and connect you and your child to what you might need. So I think, again, it boils down to that we have caring adults at school and we have caring adults out in the community that are willing to work together.
Kindergarten screenings are a way to ensure that a child is developmentally ready to start kindergarten and to determine whether there needs to be any additional support set in place in the classroom. So another important area of a child's development is the child's emotional well-being. So Wayne County Mental Health, in addition to the traditional kindergarten screening process, has partnered up with schools to provide an early recognition screening tool. And this screening tool is able to gauge a child's emotional wellness. This tool is just a simple checklist, and it's able to just show a snapshot of how that child's emotional wellness is at the time. And we're able to determine from the results of that screening whether services would be beneficial or more further evaluation would be helpful for the child. So in addition to sharing with parents the results and making some follow-up recommendations with the families, we're also able to share that information with schools so that they know any emotional wellness issues that their incoming kindergartners could have coming in, as that could certainly affect their ability to be successful in their first year of school. During the screening process, I'm occasionally approached by a parent who is unsure whether their child is socially or emotionally prepared to attend kindergarten that year. So what we'll do is typically go over a list of questions to help that parent with making that next decision. In those questions, we will ask, is your child self-confident? Are they able to make friends, take turns, and share? Do they have experience taking directions from another adult? Can they manage their feelings? And are they able to separate from you? Can they communicate their needs and ask for help? And can they complete a task, even if it's a task that they are not interested in doing? And these answers are typically able to help parents see kind of a bigger picture with their child's own kindergarten readiness. And so some tips that I would typically give a parent to help their child prepare, even in that summer just before school starts, would be to enroll their child in a good pre-K program, have them involved in some social interaction, work on controlling their impulses, thinking before they act, help them to follow verbal directions, and help them follow through on a task without being distracted. In the last 11 years that I've been with Wayne County Mental Health and collaborating with schools, I've certainly seen an increased acknowledgement from schools that students, if they had any form of a mental health challenge, that it could certainly affect their success in a classroom. And with any lack of supports that are in that school, could certainly affect or play a role in students who have poor attendance, academic or behavioral issues, or high dropout rates. So since then, we have definitely seen from our schools, not only are they asking from the community resources in the area to not only provide in-person and satellite services into their schools, they're actually, they've been asking to have presentations brought into the schools for not only their students, but for parents as well. Schools are holding more community events or school events where they invite community resources in to share about the resources that could be helpful for their families. There are also requesting trainings brought in for their staff as well. So staff are able to identify and address any mental health issues that could arise with any of their students. And schools are also identifying, addressing students' mental health needs as part of their school's mission and vision statements as well. So in a county where there's been a lengthy history of poverty and trauma, and where transportation is typically the typical barrier for a family to be able to receive those resources, for schools to be able to house them in their building and sometimes year round, has truly been able to show that they can provide a safe and supportive environment for their students, which is essential to the needs for them as well.